So I show you just some video I took in operation room. So you can see that the length of the scar is 1.5. It's 1.5 at the end of the procedure, and it's also 1.5 before incision. So this is another case. So you can see on the left, just after the pocket making, it's 1.5. The right, after insertion of the implant, was 1.52. And on this case, it's always the same. It's 1.5 centimeters before and after inserting the implants. So now I will just show you some results. So you can see on this patient, she wanted to have a natural shape, a C size in her brow. So I performed an invasive breast augmentation with a dual plane 1 because she has a natural inflammatory fold before with a B size. So I use a 420 cc Impleo implants. And you can see that after the breast augmentation, the shape is very natural and the size is very nice. The scar is not visible on the breast. You cannot see the scar. So this is another patient. So with this patient, she didn't have an infra-mammary fold before the augmentation. So I had to perform a dual plane 2 technique procedure through 1.5 centimeter scar, and it was possible. And the volume was a 360 cc Impleo implants. So you can see that after the breast augmentation, the result is very good, is very natural. The size is good too. It was a small C, and you cannot see any scar on the breast. So the patient was very satisfied. So this is the concept of mini-invasive breast augmentation. So the most important in this concept is to respect the integrity of the breast anatomy, because the breast is very important for the beauty of women's body, but it's also very important for lactation and breastfeeding. It's very important also to be able to perform dual plane procedure, because dual plane procedure is very important now to have natural results. So we must use inframammary scar, and we can perform it through a 1.5 mini scar thanks to hydrocone and Impleo smooth implants. So with this technique, I can guarantee that the results will be very, very natural and the scar will be almost invisible. So I would like to thank a lot Marta and GCA Aesthetics team for asking me to make a presentation on my technique. If you want to do, if you want to see this surgery, if you want to do it too, so you can come to Paris, France, but also in São Paulo, Brazil, and in Dubai City, Emirates, where I can operate. So please feel free to contact me on Instagram, on my website, and I will be very honored that you can come to see the procedure. Okay, thanks a lot.
Thank you so much. Merci beaucoup, Dr. Yesterday. It has been very instructive, very interesting, because it's a combination of different things and the result is completely different. Congratulations on the results. All the patients that you presented, the results were very nice.
Thank you.
So I think this is telling you that, this is telling people that this approach is a very nice approach, and that it can be, as you were saying, it can be shared, and it's something that surgeons, especially the new generations, need to take into account. We already have some questions. Why do you think there are still so many surgeons using the traditional method that is much more invasive? So we are seeing, as you were showing, some incisions of like 4 or 5 centimeters. So what is your opinion on that?
I think because they don't use hydrocone and soft gel implants. You cannot perform this mini-invasive procedure without hydrocone and without very soft gel implants.
Okay, so this is key for developing this mini-invasive technique. How important is the implant and the use of hydrocon in this approach? So this would be more or less linked to the previous question.
The implant is fundamental. That's why I say during the presentation. So you must use a smooth surface and a very soft gel implant with high cohesivity. So the shape of the implant will remain the same. You can insert through a very, very small incision, but the shape of the implant will remain the same after. So you can see that the results are very good.
I see, because a lot of surgeons are using textured implants, and you are using a smooth implant in this case. One of the concerns they may have is that maybe you will get some kind of flipping or bottoming out. How you avoid that?
You avoid that by performing a perfect pocket for the implants. Your pocket must be perfect, and you perform also a dual plane procedure. So you cannot have flipping with that.
So this is a very important thing, because a lot of surgeons that move from texture to smooth, they're facing this issue, right? This complication. So this is an important point. Regarding your patients, are you seeing a trend towards less invasive procedures? Are your patients asking for like smaller scar in this case?
Yes, absolutely. So the patient, they want a perfect result. So they want that the scar will be not visible at all. So the best we can do is to make this technique with 1.5 centimeter. So sometimes for small implant, I perform 1 to 1.5 centimeter, but they are asking, they're asking when you see them in our patient clinic.
And well, the pictures, the after pictures you show, the scar was not visible, but of course there is a small scar there of 1.5 centimeters. Are you doing something special, any kind of treatment, any kind of following up, or the result is good enough so you don't need to do anything?
Yeah, so it's a very, very small, but I recommend solar protection during 1 year and to some cream massage the first year.
Okay, so I mean, the results were already very nice, so I don't think they are concerned on that, and especially because you are doing the incision below, so you cannot see the incision, right? We have another question. Well, first of all, they are saying nice talk, so they are congratulating you on the talk. You mentioned that you were using dual plane, but do you ever do prepectoral or subglandular plane as well?
In some case, yeah, you can, some patient who do some fitness, bodybuilding, so we can perform subfacial, just under the fascia of the pectoralis major muscle, only in this case, but the results with the dual plane is better, it's more natural.
So you prefer dual plane over the other options. You also mentioned that the transaxillary approach. So you are not using this approach, I understand.
No, because the scar is too long in the axilla, and you cannot perform a dual plane procedure. So no interest to do it.
You also mentioned that you are using smooth implants. In France, there is a question regarding that. You have smooth implants and microtexture implants as well. What you don't have is macrotexture implants, right?
Yes. So since 2019, so texture implants are forbidden in France.
Macrotexture, in this case, I guess it's macrotexture, right? Because of by LCL. There are some countries that, so France, Canada, and Australia, I think you are having these implants banned, but of course in the other countries in Europe, we have all the options available. I was going to ask you, do you, I mean, how did you learn this technique? Is something that you developed, or it's something that you learned because you were also doing some trainings in Brazil or in Japan? Is it something that you put together, this combination of factors, or it's something that you learned from other surgeons?
No, it's just a technique I developed the concept because 10 years ago, I was doing a lot of microsurgery in public hospital. I was working always on microscope with a very small instrument. I was always doing that. So I was trained to do small surgeries. So I use all the techniques of microsurgery for my procedures in plastic and cosmetic surgery. So I developed year by year this concept.
No, that's great, and I'm sure that the patients will be super satisfied with this minimal invasive procedure. We have another question. Also, they are congratulating you. Excellent presentation. Do you think with a smaller incision, are you potentially reducing the risk of future bottoming out?
Oh, yes, true, yeah. But I put some special stitch through this small incision to avoid this problem. So it's very special. So people should come and see the technique.
Mm-hmm. So yeah, that's a good point. That of course the bottoming out. Of course, the gravity of the implant, the weight of the implant can also help to develop this bottoming out. And with this smaller incision, this can be somehow avoided or at least minimized, right? We have another question. Let me see. Okay, so yeah. So is there something that you would like to share with the audience, something that you think it's key, something that, of course, you are a young surgeon, of course, you have now a lot of experience and you are having these surgeries not only in France, but also in Sao Paulo and in Dubai. But is there something that when you started, is there something that you would recommend or suggest to other surgeons to avoid or to do it different?
Yeah. So for me, the only advice I will share is just to take your time to do the surgery. So me, I perform this procedure. It lasts 1 hour, 1 hour, sometimes 1 hour and 5 minutes, 1 hour and 10 minutes, but almost 1 hour. So I have some colleagues in Paris, so they operate a lot. Okay, they do very large scar and 5 centimeters, sometimes 6 centimeters. They didn't perform a dual plane procedure, and they just make the procedure in 30 minutes. Okay, so they can operate a lot of more patients than me. Okay, so they can operate 6, 8 patients a day. But I think it's not important. Okay, just take your time. Take your time to do the procedure. Try to have the best results. If the operative time is 20 minutes longer, it's not a problem. The most important is to have the best results for the patient, and that the patient will be highly satisfied.
Mm-hmm. Yeah, for sure. First, you take your time at the beginning, and results will come after your, of course, there is also a learning curve, right? So people need some time and to do a lot of surgeries to learn these things. But I have heard some comments regarding hydrocon, right? Because of course, hydrocon adds a small cost, but an extra cost that maybe some surgeons say, I don't use hydrocon because it's an extra cost. What would you say to those surgeons?
No, hydrocon is just 60 euro. So 60 euro is nothing for patient. So you can use easily. And there will be less bacterial contamination of the implant, so less infection. It's very important to minimize the scar. So no, I highly recommend hydrocon. So before, I started 10 years ago, I used another brand. Okay, it was a US brand. It was, I think it was almost the same price, maybe a little bit more expensive. But since 2 years, so I started to use hydrocon, and for me, it's the best insertions implant device that I ever used. So I really recommend hydrocon.
So I understand that you are using hydrocon in all the surgeries.
Yes, in every breast augmentation surgery.
So it's part already of your best practices. It's part already of your protocol on when you are doing breast augmentation.
Yes.
Okay. Okay, so I think we don't have more questions. We really appreciate you being here with us. It has been very easy to understand the concept for us, and I think you are getting fantastic results. That is the most important thing for patients and of course for the surgeon's credibility, right? So we really are honored to have you on the academy, and of course you are more than welcome if you want to do another webinar at another point. Thank you so much, and merci beaucoup. And,
thank you, Marta.
And hopefully we'll see each other, and good luck with this technique. I'm sure it's going to be a success, and it's already a success, at least in your clinic. Thank you so much.